We would like to acknowledge the Dharawal people who are the traditional custodians of this land on which we stand upon today, along with the Wiradjuri people who we have based our presentation on. We would also like to pay respect to the elders, past and present, of the Dharawal and Wiradjuri nations, whilst extending that respect to other Aboriginal people present. During this presentation, our group will be discussing health promotion targeting diabetes mellitus in the Aboriginal and Torres Strait Islander community in Bathurst, Regional New South Wales. The Wiradjuri people are the people of the three rivers, the Murrumbidgee, the Kalari, which is now known as the Lachlan River, and Womble, today known as the Macquarie River. The Bathurst Council encompasses this land as a land of the Wiradjuri people, which extends over the Blue Mountains in the east, Hay in the west, north to Nyngan, and south to Albury. They have lived in these lands for more than 40,000 years. Living in these areas of Bathurst, the Aboriginal communities of the Wiradjuri people have many needs in terms of general health care. The Bathurst community's main goal for Aboriginal healthcare requirements is to improve healthcare facilities and the overall access for Aboriginal people, as well as educating Aboriginal youth on preventing health issues from occurring, which includes diabetes. Diabetes mellitus is classified as a chronic multidisciplinary disease related to abnormal insulin production, impaired insulin utilization, or both. The first documented diagnosis of diabetes arising from an Aboriginal community was in 1923 in Adelaide, Australia. It would be a number of decades before further action was taken, as it wasn't until the early 1960s that focus was put into the statistics of Aboriginal and Torres Strait Islanders being diagnosed with diabetes in Australia. During the mentioned research, it was discovered the higher rates of diabetes coincided with the westernisation of the European arrival to Australia. Aboriginal descendants lost their ability to hunt and gather, reducing physical activity and nourishment of sourced nutrition. It is reported that Aboriginal adults are 6 times more likely to die as a result of diabetes than those of non-Aboriginal descent, and that Aboriginal children are 8 times more likely to develop type 2 diabetes than their non-Aboriginal peers. The life expectancy of the Wiradjuri people is 60 years for the men and 65.1 years for the women. This equates to 17 years less than the non-Indigenous population in the Greater Western Area Health Service. It is estimated that 1 in 8 Indigenous adults have diabetes, being more common in the female population. 2% consists of adults between the ages of 18 to 34, and 46% consists of the adults 65 years and older. Additionally, Aboriginal women have an increased risk of developing gestational diabetes in pregnancy. If untreated or undiagnosed, it places intense pressure on the health of the mother and the baby, with risks including miscarriage, stillbirth, hereditary deformities and respiratory distress in the baby, and preeclampsia, the need for a caesarean, and possible preterm labour for the mother, resulting in long hospital stays and the increased risk of infection. The Aboriginal and Torres Strait Islander population experience higher levels of disadvantage compared to non-Indigenous people. This includes lack of education, lack of employment, lack of health service access, and homelessness. In a study carried out, it was determined that risk factors for diabetes in Aboriginal and Torres Strait Islander people include obesity from lack of nutrition, hypertension, abnormal cholesterol and triglycerides, smoking, and the consumption of excessive alcohol. In recent years, the introduction of education and healthcare support has been implemented by the government via the Close the Gap campaign, which is discussed later in this presentation. Diabetes has a substantial impact on Aboriginal and Torres Strait Islander communities. Whilst diabetes alone may cause premature death, there are many other preventable illnesses diagnosed from complications related to untreated diabetes. Examples of these complications include, but are not limited to, heart attack, renal deficiency and/or failure, stroke, depression, and the increased risk of infection-related diseases such as amputation and septicemia. Short-term complications can include diabetic ketoacidosis, hypoglycemia, and slower healing of wounds when acquired. Aboriginal Australians also have a higher chance of developing psychological symptoms. It was identified that there were a higher rate of lifetime depression, current late life depression, and suicidal ideation among the Aboriginal population. Psychosocial disadvantages play a big role in the deterioration of mental health. This includes high rates of unemployment, mostly derived from lack of education, racism, trauma as a result of the stolen generation, lack of financial security, and lack of community-based support. According to the 2016 New South Wales census, the total population in Bathurst was 42,389, 2,246, or 5.29% of which were Aboriginal and Torres Strait Islanders living in Bathurst. Of the 2,246 Aboriginal and Torres Strait Islanders, only 42.3% had completed Year 12 education or equivalent, and around 2.6% of Aboriginal people in Bathurst are employed. The median income for Aboriginal men and women is roughly $20,905, which is 45% of that of non-Indigenous people, being $46,456. Concluding that Aboriginal and Torres Strait Islanders are classed in a lower socio-economic status than non-Indigenous people. This means that Aboriginal and Torres Strait Islanders living in Bathurst are in a low socio-economic bracket, leading to the many social determinants of health that Aboriginal and Torres Strait Islanders face regarding living with diabetes mellitus. Social determinants include income and social status. Being that Aboriginal and Torres Strait Islanders tend to be in a lower socio-economic status, they have trouble earning a median of $20,000 a year, meaning they struggle to pay for any treatment they may need linked to diabetes mellitus, education, or lack thereof in Aboriginal and Torres Strait Islander people, affecting the way they seek out treatment for their health, or even a vague awareness of what their illness and disease means to them and how it may affect their health and future. Social support networks in Bathurst consist of the Aboriginal Health Clinic. Aboriginal and Torres Strait Islanders have the option to go to a health clinic if they are not interested or willing to go to a hospital or the Aboriginal healthcare team at Bathurst Base Hospital, who specialise in Aboriginal and Torres Strait Islanders' safety and well-being during their stay in the hospital. Limited health services available in Aboriginal and Torres Strait Islander communities impact on the options they have to treat their illness. As Aboriginal and Torres Strait Islander people have difficulties in managing their diabetes for numerous reasons, they may run into complications whilst seeking employment. If they are unable to manage their illness, they might require excessive time off during the worst parts of their illness. Aboriginal and Torres Strait Islanders tend to live off the land in remote areas. This means they have access to natural foods of the land. If they live closer to suburban places due to their low income, they can afford basic foods that can contribute to diabetes. A large majority of Aboriginal and Torres Strait Islanders have minimal personal health practices and coping skills to deal with their diabetes due to the lack of knowledge and education in the illness and its effects. Biology and genetic endowment play a role, as diabetes can be hereditary and passed down from generations, whilst at the same time some people may contract diabetes due to their way of living. The following video is an Australian government compilation of stories from the Aboriginal and Torres Strait Islander Health Survey, which was carried out in 2012 and 2013. Please be aware that images and voiceovers used in this video may be of persons who are now deceased and may cause distress to some viewers.
Hi, my name's Blake Tatafu. I'm a Wiradjuri Dunghutti man from Western Sydney, and I'm here to talk to you about the Australian Aboriginal and Torres Strait Islander Health Survey, which was run by the Australian Bureau of Statistics. Our people experience poor health outcomes at higher rates and at younger ages than non-Indigenous people. The Australian government is committed to closing the gaps in health outcomes, and the survey provides important information to help achieve this. About 13,000 people were surveyed in communities and areas in metropolitan, regional and remote parts of Australia. If you were chosen, it means that you're representing not just people in your immediate community and area, but also people who live in similar areas to you. Some of the information collected was personal or sensitive, but don't worry, everything collected by the ABS is kept confidential and can't be used to identify individuals or communities. It also means no one outside the ABS will ever see anyone else's health information, including other government agencies like Housing or Centrelink, researchers or marketing companies.
Hi there, my name is Dr. Dana Slape. I'm a Larrakia woman and I work at a hospital in Western Sydney. The ABS recently ran the biggest ever health survey for Aboriginal and Torres Strait Islander people. You and your family may even have been a part of this, and if you were, we want to thank you for your contribution. Now that the results are in, we want to share the story with you, as the information gained is not just for the government, but it's for our people too. We can all use it to make good decisions about our health and our future. The survey collected lots of information about people's health, like how healthy do we feel, how many of us have a health condition like kidney disease or heart disease, and are our kids eating well, and are they eating the right kinds of foods? All the data comes together to give us a big picture of our health, which tells us a lot of interesting things. 3 in 4 of our people said that they were in good health, very good health, or even excellent health. It also tells us what sorts of foods we eat and how much exercise we're getting. It's great to see our kids are eating plenty of fruit, but we also need to get them eating more veggies too. A healthy weight helps us live longer and get more out of life. Giving kids healthy food gives them the best possible start right from the beginning. Eating nutritious food improves every part of our health and reduces the chance of us getting things like heart disease, diabetes, and even some kinds of cancer. Finally, let's look at diabetes. Our people are over 3 times as likely to have diabetes as non-Indigenous Australians. We also get diabetes at a much younger age. Diabetes puts you at risk of having a heart attack, having a stroke, or even having trouble with your vision. This survey showed that around 1 in 10 people have diabetes in our communities. Even more importantly, as many as 1 in 6 who have diabetes aren't yet aware of it. That means that there are lots of people who aren't getting the medical attention that they need. Knowing if you have diabetes helps you to manage it, perhaps eating healthier food, doing more exercise, or popping into the clinic a little bit more often. That will keep you well and strong.
So now that we have all of the information, how is it going to be of use to us and our communities? The information is already being used to better understand what health services and programs are working and where more money and effort is needed. It's being used by organisations like the Heart Foundation and the Kidney Foundation to target health programs for our people and communities throughout Australia. More importantly, our people can use the information to help us make good decisions about our health, our future, and to make sure our kids grow up strong and happy.
The World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. It moves beyond a focus of individual behaviour towards a wide range of social and environmental interventions. Health promotion is best achieved through a program, one that includes the lifestyle of the particular community and attempts to influence the determinants or etiology of bad health. This combines methods depending on the active participation of the community. It pays attention to the cultural traditions and their way of life. One of the most well-known campaigns recently introduced is Close the Gap. Supported by Oxfam, a charitable organisation founded by Cecil Jackson Cole in 1942, the Close the Gap campaign is a health promotion strategy that directly affects Aboriginal and Torres Strait Islander people. Overall, the Australian government are achieving a slow but steady impact on the Aboriginal community health as a whole. This is identified through improvements in life expectancy, a decrease in diabetes mellitus, and the increasing number of Aboriginal people attending and finishing schooling. As of 2017, the Close the Gap campaign has recommenced the process, and although the goals were not met the first time, the Australian government are allocating more money and resources to ensure all the prior goals will be met by 2030. The Wiradjuri people would consume foods such as murray cod, yabbies, and other fish that they found in the rivers. During the summer, when the rivers would dry up, they would eat meat such as kangaroo and emu, or fruits, berries, nuts, and wattle seed. The people would relocate to where the food is, depending on the season and availability of foods to them. Bark canoes and rafts were a main form of transport for people in the Wiradjuri community, as they were surrounded by the three rivers, the Murrumbidgee, the Kalari and the Womble, which we discussed earlier in the presentation. The Wambidgee Community Support Service is a centre that supports Aboriginal and Torres Strait Islander people and their families by providing links, advocacy and referrals to a range of services, which may include welfare and social support. If Aboriginal and Torres Strait Islanders have access to the internet and/or a phone, they can book an appointment via email or telephone call. If this is not an option, they can attend the centre and either book through the front desk or use the centre's free Wi-Fi to book their appointments. The Aboriginal Health Team at Bathurst Base Hospital provide Aboriginal healthcare workers to assist the Aboriginal and Torres Strait Islander people to establish a patient journey, which allows them to feel safe in the hospital environment. Aboriginal healthcare workers offer help with support for any issues health-wise that are affecting them, guidance on how to address the issue, education and advice on what the health issue is and how best to improve and maintain it. Language interpretation is also provided, as there are no misunderstandings regarding the illness and treatment options. Health promotion is the process of explaining treatment and benefits whilst encouraging prevention tactics to patients. This allows the patient to gather an understanding of what their illness is and how it could affect them. The team initiate a 48-hour follow-up to ensure the patient is aware of what needs to be done and is completing instructions of care. Referrals and links to other services, including doctors, Medicare Local, and the community services. The only option of transport to getting to this service is to either drive or have someone else drive you, or if you live close enough, you can walk and no appointment is necessary. From the information here, it is clear that the Aboriginal and Torres Strait Islander people are an extremely culture-based community. The Aboriginal and Torres Strait Island culture is based on the respect for both the land and the elders. They identify themselves as part of the land, as well as the environment and community in which they live. They have strong social connections with their environment and believe that they are born to the land and that it is inherited. Due to these strong connections, the Aboriginal and Torres Strait Islander people define health as the holistic, cultural, social and emotional well-being of the whole community. It is important to note that nurses need to be aware of different cultures to be able to create a culturally safe environment for everyone. For a nurse to create a culturally safe environment, they need to become culturally competent. This is shown through a series of steps indicated in Figure 2. The first step is cultural knowledge, and simply means gaining the research information about the Aboriginal and Torres Strait Islander people, understanding historical events that may have or may still be impacting on their lives. The nurse is able to reflect and share these experiences with others. Through reflection, nurses are able to understand why some communities may have negative views towards the healthcare system and receiving help for health issues. Reflecting enables the nurse community to become culturally aware and sensitive. They are now able to recognise the values Aboriginal and Torres Strait Islander people hold, including similarities or differences. However, cultural competence can only be attained once the nurse is able to interact, be respectful, and understand the meaning of illness, health, and quality of life in their culture. When the nurse is culturally competent, they are able to create a culturally safe environment for the Aboriginal and Torres Strait Islander people. Together in this environment, patients form a trust with the nurse, which then forms a trust within the wider community as they work together to help manage the health issues. Effective communication between nurses and Aboriginal and Torres Strait Islander patients is an essential component in providing a positive health outcome for both parties. Ivan Lynn explains the process of yarning. Yarning for the Aboriginal people enables them to connect culturally in an informal manner where the exchange of information is done through conversation. Incorporating yarning into the nurse's clinical conversation can improve communication and care of the Aboriginal and Torres Strait Islander people. They are able to portray their holistic perspectives on health and what is considered a culturally safe environment. The Australian Home Medicines Review was founded to reduce hospital admissions, improve medication safety, and reduce adverse events. It requires a range of different health care professionals to collaborate with the patient. This is usually done within their own home in reviewing medications and consultation with the patient's general practitioner. The aim of the HMR is to empower patients to understand and seek information about their medications. This will then have a flow-on effect of increased medication adherence and ultimately improve relationships between themselves and health professionals. Although this can benefit the Aboriginal and Torres Strait Islander people, many are not comfortable with non-Aboriginal people entering their home. In addition to this, the health professional will require cross-cultural training and building trust within the community. Trust can be formed by working alongside community members over a period of time. Due to the regional area in which the Aboriginal and Torres Strait Islander people live, continuity of care may not be provided. This is due to a number of reasons, including a high staff turnover, medication access, and not having appropriate specialist services. Health for the Aboriginal and Torres Strait Islander people is not viewed in the same way as non-Aboriginal people. It is about their social connections with their immediate environment as well as their community in which they live. Health to them is not only a holistic view, but also the cultural, social, and emotional well-being of the community in which they live. In summary to what we've discussed, our group determined the decline of healthcare in Aboriginal and Torres Strait Islander communities. We focused in particular on the Wiradjuri people in relation to their socio-economic status and types of healthcare available. It became apparent that there was a need for additional facilities, including the implementation of education strategies. Education for the younger generation needs to be taught in terms that can be easily understood across all ages. Understanding health and health issues will provide the children of the future the skills to make appropriate decisions in regard to their health through to the family planning stages. Mental health awareness is paramount. Many of the Aboriginal and Torres Strait Islanders in Bathurst are members of the stolen generation. Whilst the hurt they have suffered can never be reversed, strategies need to be placed in assisting them to improve their trust in the Australian healthcare system, therefore encouraging residents to seek medical intervention. Government-funded community-based training can be implemented to assist Aboriginal and Torres Strait Islander people to enter the workforce, thus leading to higher socio-economic status. The Close the Gap campaign is an appropriate initiative, but a more aggressive approach is required to implement the changes and improvement a lot sooner than 2030. Thank you. This presentation was brought to you by Jeanette Newham, Geronimo Smith, Chantal Smith and Sigrid Williams in 2018, who were Bachelor of Nursing students of Western Sydney University, Campbelltown.